Hi, everybody. How are you today? I'm John from HB Pharmacy, and I'm very privileged to be with Ashni Rana, who is a sixth-year pharmacy candidate for receive her doctorate this coming May of 2021. And we were discussing today about inhalers. A lot of people use metered dose inhalers, and we want to make sure that people are actually understanding how to use them, how to maintain them, and why, in fact, we actually need them. So to start us off today, Ashni, so what are some of the reasons why a person might need an inhaler?
Yeah, so there's definitely a group of people who would benefit the most from using an inhaler. These would be people with conditions such as COPD, emphysema, asthma, or other conditions that may cause inflammation in the lungs, such as bronchitis. So with these different conditions, the lungs get changed, and it may become difficult for a patient to breathe or take in a good deep breath. So you can think of the lungs as almost like a balloon. So you want the balloon to get bigger, and then when the air goes out, you want it to shrink. So with some of these conditions, that balloon essentially becomes stiff, so it doesn't get bigger and smaller as it should. And this is where inhalers can become very helpful.
Right, that sounds great. And one thing before we get actually into the meat of talking about the inhalers is that we did want to bring up something called the peak flow meter. A peak flow meter is an interesting tool, and it's an underutilized tool. And while people need inhalers every day for these various conditions that they have that we just spoke about, a peak flow meter is actually something that can measure you use it on a good day to see what your best volume of air is and how strong your lungs are. And what happens is there's little signs on this you can see, and they're just yellow, red, green, etc. And what happens is when you're using this properly, you can actually forecast problems with breathing that could end up with, if they're not addressed, you could end up with a trip to the emergency room and things like that. So using a peak flow meter can help you forecast far before you ever have any adverse symptoms. It'll help you forecast what's going on. So it's a very interesting tool to use. And if you have any questions about that, certainly make sure you reach out to us, and I'd be happy to talk to you more about that particular device. But now specifically, when we are talking about inhalers today, can you tell me the different types of inhalers? I know that there's some that you're supposed to use right away, and that there's some that some people use all the time. So let's talk about some of the differences.
Yeah, sure. So inhalers can be broadly split into two different categories. You can have rescue inhalers and maintenance inhalers. So rescue inhalers are the ones that, as you mentioned, you would use immediately when needed. These inhalers usually contain a medication called albuterol, which starts working in about 15 to 20 minutes and will last 4 to 6 hours. An example of it would be an inhaler such as this, which is a ProAir inhaler, and other albuterol inhalers include Ventolin and Proventil, and we'll be discussing more about the rescue inhalers later on as well. The second category is the maintenance inhalers. These are the ones that you would use daily, every day. You try to use it at the same time every day. These usually contain a combination of medications. So you'd usually have maybe a corticosteroid, which will help to decrease inflammation in the lungs. And there will also be a long-acting medication in it, which will help to open up the airways. And we have some examples here of different maintenance medications. So this one is a Trelegy inhaler. We have an Advair inhaler here as well. And then this is the Stiolto Respimat inhaler. So those are just a few of the different types of inhalers that we have.
So I have a question for you, because this kind of looks all confusing, right? So, if I'm a patient, how do I know? Let's say I'm on, this and this, the Advair and the albuterol or ProAir, and I'm having trouble breathing, right? All of a sudden I have shortness of breath. I can't catch my breath. How does a person know whether to go to an Advair, or how do they know whether to go to the albuterol? What's the kind of the guidance there?
Yeah, so great question. So with those maintenance inhalers, you're just going to use that. You would use that every day. You're going to use that at the same time every day. Whereas with the rescue inhaler, such as the ProAir inhaler, you're going to use that when you have a sudden difficulty breathing, any wheezing, maybe some chest tightness. So for symptoms like those, you would reach for your rescue inhaler. And then again, it would take about 15 to 20 minutes to work. So you can also use it before something like exercise, because a lot of times exercising can worsen those symptoms. You may have difficulty breathing with exercise and have that wheezing and chest tightness again. So it's good to use the rescue inhaler before exercise to prevent any worsening of those symptoms.
Right, I know that we fill a lot of prescriptions for patients that, when they're going out and they're about to go play soccer, they're out in the running track and they're out in the fields in the air, and some triggers that are out there can cause problems, so they do that proactively to prevent a situation from occurring. Is that right?
Yeah, exactly.
Right. So if let's say it's an emergency situation, so I don't go to the Advil because this may take a while to start working, and this is going to work right away. What are some of the steps you do when you want to go ahead and use a ProAir?
Yeah, so before you even use the inhaler, the first time you get it, you actually have to do something which is called priming the inhaler. This is a lot like testing the inhaler to make sure it works. It's similar to if you have a pump of lotion or hand sanitizer, you might have to pump it a few times before something actually comes out. So you would do the same thing with the inhaler. So I'll just demonstrate it with this ProAir inhaler here. So this is what the inhaler looks like. So in order to prime it, you're going to remove the mouthpiece, which is this white part here. You're going to hold it away from your face, away from anyone's face, and you're going to shake it for 5 seconds. So it'll be 1, 2, 3, 4, 5. And then again, holding it away from your face, you press down on the canister from here in order to spray the inhaler.
Excellent.
Should I do it? Okay. It's going to be like that. And then you're going to do this 2 times. Depending on your inhaler, the manufacturer might require you to do it more times, but that's essentially how you would prime the inhaler before you first use it. So it's important to do this before you ever use before the first time you use the inhaler. But you should also do this if you don't use the inhaler for 2 weeks, just to make sure that the medication comes out properly when you do use it.
Great, that's great information. So basically, if I'm using that fairly regularly, I don't have to worry about priming it. But if it's only in an emergency kind of thing, and I haven't used it in a while, 2 weeks, I have to reprime. That's good to know. So now we're to the point where you've gotten it primed. What's the best way? What are some of the key points that we can bring to our patients to let them know what's the proper way to use this rescue inhaler?
Yeah, so in order to use the rescue inhaler, so you have the canister of medication on top. You have the device, which is red, and the mouthpiece. So in order to use the device, you're going to remove the white mouthpiece. You want to shake the inhaler again before you use it. So this is going to be for 5 seconds. Then you're going to put the inhaler into your mouth. While pressing down on the top of the canister, and the medication comes out, you're going to inhale at the same time. You want to take a deep, slow inhale in. You want to try to hold the medication in your lungs for about 10 seconds. If this feels too long, you really just want to hold it as long as you can if you can't do the full 10 seconds. But if you can do the 10 seconds, that's really great. After that, you're just going to exhale slowly and deeply. If your doctor instructs you to take more than 1 puff at a time, you do just want to wait in between taking the puffs. This is because you want the first puff to get into the lungs and open up your airways. And this will help because when you take a second puff, the medication will be able to go deeper into the lungs and have a better effect.
So that's an important thing to note. So if you're getting 2 puffs, please allow some time in between each puff, because sometimes I've seen patients where they're showing me that they're doing it, and they're hitting the actuation, just again twice like this, one right after the next, and that's definitely not the best way to do it. As Ash just pointed out, the second dose will work much better because of the way the first dose is already starting to work if you wait that 1 minute at least interval. Okay, so that's good. So how do you know, sometimes you're not sure if you can see something or see something coming out. How do you know that you've gotten the dose?
Yeah, so it's really important to note that when you use the inhaler, there won't be any taste with it. So if you don't taste anything when using the inhaler, that's good. You shouldn't taste anything, so don't expect to have any taste. Some inhalers, such as this one, actually have a dose counter on the bottom. So this one, after it's primed the first time, it'll show 200, and then with each with each dose that it gives off, the number will decrease by 1. So you'll know that way that the medicine is coming out. And then also just priming the inhaler will really help to make sure that the medication is coming out. There's also inhalers called Respimat inhalers, which I can show you a placebo device here. So with this one, it's considered a soft mist inhaler, and you actually see the mist coming out of it. So if I open the top, with this inhaler, you would just twist the bottom to get the medication, and then when you press the top, you see the mist actually come out.
Great.
So with that one, that's another way so that you can know that.
So that's another thing. So there's really, there's a lot of different devices out there and technology, so it's good to make sure you take the time to speak to your pharmacist because your particular device, although many of these have similar medications, there are different ways to use them, and you want to make sure you're getting the maximum benefit. So my next question for you would be this is a pretty simple device. It comes apart pretty easily. What's involved beyond how we use it? Are there other things that we need to worry about, maintenance and such, and that type of stuff? Is there any information we could provide for that?
Exactly. So for the maintenance, especially with your rescue inhalers, you want to make sure that you clean it about once a week. This is because if you don't clean it, the medication can actually get clogged inside, and then you won't get the proper medication when you try to use the inhaler. So in order to clean it, you're basically going to take the different parts apart. So you're going to take off the mouthpiece, and it's important to take out this canister. The medication comes in this canister, which is metal, so you don't want to wash this part. The part that you will wash is the red piece here. So in order to do that, you'll run warm water through it for about 30 seconds, and you want to run the water from the top, so going in through this side, and the water will come out from the bottom. And then you also want to do it the reverse as well. So another 30 seconds, run the water from the bottom through the top. After this, you just want to shake it out to make sure any extra water comes off, and then you leave it to dry. And then after that, you'll be ready to use it again, and you won't have a clogged meter.
Yes, and then more importantly, you'll get the whole full dose that you're supposed to get. So now, sometimes we're taking these ourselves. Our patients are doing that, and sometimes it's for maybe a child or something like that. What are some of the most common or prevalent side effects that you might see coming from using this, so we could explain that to people?
Sure. So after using the inhaler, some people may feel nervous, shaky. They may experience increased racing heartbeat as well. So this isn't something that you should be super concerned about. It is relatively common when using the albuterol inhalers. After using the inhaler for a few days or a few weeks, you won't experience this after using the inhaler again. I
was thinking that the side effect might be a dog barking, but I'm not sure if that was. But anyway, so much for my bad joke. So now we're having. So that's the rescue or the emergent kind of thing. Now, if we switch back to our maintenance inhaler or something that's used every day to treat some of those chronic diseases, like we're talking about COPD, which or emphysema or asthma, people are familiar with. If I'm feeling good, for example, it's a good day, it's clear, I'm feeling all right. Can I skip on a day like that, or what do you think?
Yeah, it's a great question. So it's really important to know that you shouldn't skip using the maintenance inhaler, such as this Advair. You really want to use it every day, use it at the same time every day as your doctor instructs. Even if you're feeling good, if you don't have any symptoms, you can breathe well, it's important to continue using this medication because it has a long effect. So even if you're feeling good today, when you use it today, it'll help you in the next few days to keep feeling good.
Right, so yeah, some of these things now, like the inhaler, this Advair has 2 ingredients in it, right? So one is something similar to the ingredient that's in this, right? But then there's also an anti-inflammatory medicine or a steroid medication in it, right? So is there any difference in terms of like a device like this versus something like this in terms of how it's used?
Yeah, so we discussed how to use the rescue inhalers earlier. So you're going to press down on the top and breathe in at the same time. The maintenance inhalers are a little bit different because you're not pressing down on a button to get the medication out. You actually get the medication when you take a breath in. So with your medication, with your maintenance inhalers, you first want to exhale deeply, and then you'll put the inhaler to your mouth, and then take a deep breath in to get the medication. After this, you're going to use it the same way that you use the rescue inhaler. So you want to try to hold the medication in for about 10 seconds, or as long as you can, and then you'll exhale slowly. And then it's just important also, before you use the inhaler, when you're exhaling, just make sure to exhale away from the inhaler, because might be powder inside, and you don't want that powder to blow out.
That's great. So, I know we briefly discussed some side effects, but I've had patients come in and they've experienced various kinds of problems, things like sore throats and other problems with infections and stuff like that. Can you speak to those comments from those people? What's going on there? Why is that happening?
Yeah, sure. So especially with the maintenance medications, because they contain a steroid, it may be more likely that you may get some sort of oral infection. This is known as thrush. So in order to prevent this or reduce the risk of having this kind of infection or having a sore throat after using the inhaler, you want to make sure that after you use the inhaler, you rinse out your mouth after using it. And every time you use your maintenance inhaler, if it contains a steroid, you always want to make sure that you rinse out your mouth with water and spit out the water after.
Right, so that's great information. So whenever you're using an inhaler, and there's propellants too that sometimes can irritate the throat too and cause problems. So it wouldn't hurt always to follow your advice there and make sure you do a good thorough rinse of the back of your throat, gargle a little bit, and maybe expectorate it out, and to just keep your mouth and your throat healthy.
Yep.
So now I know that especially sometimes with younger children, they have trouble, coordinating the timing of using a device like this and pressing it down and making sure they're doing that slow, deep inspiration. So there's a lot of timing involved in that. Mm-hmm. What devices are out there to help, especially kids, with that whole process of timing it and inhaling at the same time and pressing it down and doing that all?
Mm-hmm. Yeah, so the rescue inhalers do require some hand and mouth coordination, and there's devices called spacers that can help to relieve some of the difficulty with that. It may also be known as the valve holding chamber. So we have an example of one here. So basically the spacer is a long tube, which is like this, and you'll also get a mask with it as well. So in order to use it, you would attach the mask onto one end of the device, I'll show here, and then you would attach the inhaler. So you would take off the mouthpiece and attach the inhaler on the opposite side. So basically, when you press on the canister to release the medication gets trapped within this tube, and then when you're ready, you put your mouth to the mask and you can inhale it in. This way, you don't have to press it at the same time and breathe it in. When it gets trapped in here, you can just breathe it when you're ready and as you're able to.
Right, so the timing is still somewhat important. It gives you, another 10 or 15 seconds to try to figure it out, to make sure that the patient breathes in it. Not everything comes with a mask, not every spacer, because some people just use the spacer without the mask if they're old enough. The ones that are, the younger patients tend to need the mask because then it goes over their nose and their mouth and stuff like that. Is that true? Would you say that's accurate?
Yeah, that's true. So you don't need to put the mask on. You can always just breathe through here. The mask may help to make it easier, especially for younger children.
Yeah, so that's another great tool. And much like the peak flow meter that we started at the beginning, talking about spacers and peak flow meters are not always used often enough. And then the last two things we wanted to wrap up on quickly is that we have on our website, on our educational videos, how to use a nebulizer. A nebulizer is a much more powerful device that's used to get medicines like these deeper into your lungs. So the nebulizer is not, is in a situation where there's maybe a more serious situation where you have to really sometimes they use them, for example, at the hospital. A lot of people have these at home if people have ongoing treatments that they have to do. So if you do need more information about that type of device, we do have a different educational video on that. So with that, I would say that if you have any questions for us here, we're happy to go over your specific prescription that you have that the doctor has written for you. And of course, we're available always at 201-997-2010. Just ask for one of the pharmacists and we'll be more than happy to talk to you. Thanks so much. Thank you very much. Great job.
Thank you. Have a good one, everyone.